A big setback for a promising medication aimed at treating heart disease. GlaxoSmithKline's drug failed in a late-stage trial to produce a significant reduction in heart attacks, strokes, or death when added to a patient's care, which may include a cholesterol treatment, aspirin, or even blood pressure medications. Shares of Glaxo fell more than 1.5% today.
Some new recommendations out tonight affecting millions of Americans currently at risk for serious medical conditions, and the guidelines center around statins. What will that mean to the health of some of the nation's biggest drug makers? Well, Hampton Pearson has that story.
The new guidelines from the American Heart Association focus on the use of statins, not just to control cholesterol levels, but to lower the risk of heart attack, strokes, and diabetes.
Well, this is certainly a departure from prior guidelines where the focus was really on trying to get your cholesterol to goal, and now the focus is really on just trying to get started on medication and take the highest dose that you can tolerate.
The Heart Association and American College of Cardiology identify 4 major patient groups for whom taking statins lowers risk. Patients with cardiovascular disease, those with high LDL or bad cholesterol levels, patients with type 2 diabetes, and patients between 40 and 75 years of age with a 10-year high-risk cardiovascular profile.
The new recommendations really reaffirm the importance of treating cholesterol levels in our highest risk populations, those with established heart disease, those with diabetes, and those who have genetic cholesterol problems.
Analysts say there's no question statins are the big gorilla in the cholesterol-fighting prescription drug market. 214 million prescriptions a year, a 17% increase just in the last 5 years. But 2 of the biggest sellers, Pfizer's Lipitor and Merck's Zocor, have now gone off patent. AstraZeneca's Crestor will go generic in 2016. Even if the new guidelines lead to more people taking statins, analysts say it won't offset the lost revenues from those expiring patents.
It's really going to benefit just the generic market, and they, at that point in the generic life cycle, really doesn't even help the generic firms because it's really a commoditized product.
The next generation of patented statins is in the pipeline. Meanwhile, doctors emphasize drugs are no substitute for a heart-healthy lifestyle that includes a good diet, exercise, and a lot less stress where possible. For Nightly Business Report, I'm Hampton Pearson in Washington.
And here to talk more about the new cholesterol treatment guidelines and what they mean for investors is Barbara Ryan. She's a managing director with FTI Consulting. Barbara, you presumably heard that package that Hampton just filed for us. Do you have anything you take issue with there, or do you think this is really not a needle mover for the drug companies?
It's absolutely not. I mean, I think as was mentioned, given the fact that both Lipitor and Zocor have lost patent protection, they are mere shadows of their former selves and not financially relevant to Merck and Pfizer. I think there may be more increased attention on obviously products like Vytorin from Merck and Zetia, as well as Crestor, which were mentioned. But since their patents go off in 2016, there too, investors are not going to get too excited. We do have new drugs coming from down the pipeline, one in phase 3. Really a novel target that could be given once every several weeks from Sanofi, and Regeneron is in phase 3. But I think the other message that was communicated earlier is that there's really been a movement from treat to goal and a focus on what the actual cholesterol number is, but rather that patients that are at high risk should be treated, number one, irrespective of their cholesterol levels, and 2, that they should be treated aggressively with higher doses of statins, which I think that those 2 things are really the change here.
And does that change the guidelines, in your opinion, for other chronic diseases like diabetes, which is on the rise, and the like, or not?
Well, I think, you know, in some respects, I mean, keep in mind that the statins have been on the market for a long, long time and are fairly safe drugs. But I do think that this issue of early and aggressive treatment and prevention, you know, with good, healthy lifestyles is probably ubiquitous to a lot of chronic diseases.
Do you have any estimate, these new guidelines, as to how much the marketplace in terms of number of individuals will expand as a result of it? Are we talking about a 20% expansion, an 80% expansion? Do you have any guess?
My guess would be, you know, that maybe you're talking about 10 to 15%, and I think that would largely come from the fact that patients would be targeted for treatment sort of irrespective of what their cholesterol level is, but rather as a function of their risk for cardiovascular disease and, you know, the morbidities associated with that.
You know, it sounds as though also it's going towards the trend, which seems to be expanding quite rapidly, towards wellness, general wellness and general well-being, and intervening in your lifestyle earlier in your life so that you don't have some of these issues later on, or they aren't as extreme later on.
I think it's a great point, Sue, and I think it's absolutely true, and it's going to continue to be the case for a lot of different reasons. One is we as consumers are going to be bearing more of the burden of the cost of our health care, and so we're going to have an economic incentive as well as a health outcome incentive to do that. And the other is that I think, you know, the therapies and awareness and availability of better treatment regimens early on, you know, cancer in many areas is becoming a chronic disease rather than an acute life-threatening condition.
Barbara, thank you very much as always.
Thanks for having me. It's great to see you.
Oh, likewise.
Thanks a lot.
You bet.
Bye-bye.
Barbara Ryan is Managing Director at FTI Consulting.